I'm Vicki Hogarth, and welcome to Southwest Magazine. During the COVID-19 pandemic, Dr. Jennifer Russell was the Chief Medical Officer of Health and led New Brunswick through the pandemic. Now she is the Executive Director of the Institute of Population Health at UNB, and she joins me here in studio today. Thank you so much, Dr. Russell, for sitting down with me in St. Andrews today.
Thank you, Vicki. It's nice to see you.
Can we start off by talking about your new role? Tell us about first the Institute of Population Health. What is the mandate and what is your role there?
So the Institute of Population Health is a brand new institute at UNB that President Paul Mazerolle asked me to lead, and I enthusiastically said yes. It's really about upstream prevention. So it's an institute that's a hybrid in terms of it has a research component, and it also has a knowledge translation, analysis, education awareness component, and working with trying to work on upstream prevention with policy, legislation, and programming.
What do you see right now when you're looking at the healthcare system, both Canada and New Brunswick, as some of the biggest challenges we're facing now?
So before the pandemic, we knew that we had some healthcare service delivery challenges, and that's where you would see, the health council kind of reporting on health services and wait times and things like that. So we already knew before the pandemic that there were challenges. During the pandemic, things obviously got worse, and I think the healthcare system here in New Brunswick and across the country has even more challenges, whether it's workforce issues, access to family physicians, et cetera. So there's a lot of things that both regional health authorities are working on right now to try to improve things. So from an upstream prevention perspective, upstream prevention can mean anything from cancer screening to breast cancer, colon cancer screening, to any of the vaccinations and things like that, all the way to legislation around seatbelts and tobacco and things like that. So there's quite a wide range of things that you can think about when you think about upstream prevention. And so we know right now that in our province, as we knew before the pandemic, that we have an aging population. We have people needing care in nursing homes, et cetera. And how does that spill over into the healthcare system? And so anything that helps prevent chronic diseases, cancer, dementia, things like that, I'm very interested in. Looking at other research that's already been done in New Brunswick that we could look at scaling up, or looking at things that have been done in other jurisdictions, whether it's outside of Canada, outside of New Brunswick, or outside of Canada. For instance, New Zealand and Australia have some really interesting approaches to population health outcomes.
With New Brunswick in particular, I think of a lot of people that grow up here, they move away, and they come back when they're retiring. Does that create increased challenges compared to other provinces when you're having people come back at that later stage in life?
Well, I think during the pandemic we saw a very huge increase in people who moved here from elsewhere, and so I think our population went up by almost 100,000 people. I don't know the ages of all those people that moved back here, but certainly just the volume of people who have come back is really good for the economy, but I think it has challenges on the healthcare side. So I think being able to address that now is part and parcel of what the regional health authorities are working on. And I guess I see the Institute as being able to collaborate with government, with the RHAs, with academia, to kind of bridge some of the challenges and exchange that information and put that information and research into action and concrete ways to move forward.
You come at this role from a unique position, having led the province through the COVID-19 pandemic. When you look back at what you went through as Chief Medical Officer, what is that? Did COVID exacerbate certain problems, things like addiction? What are you seeing when you look at where we are now and how the pandemic may have exacerbated certain issues?
I think mental health and addictions for sure, and anything that isolation increases the risks of. I think from an education perspective, I think the youth that went through the pandemic and the effect on their academics and their mental health. I think straight on up to anybody who had predisposing issues or that preceded the pandemic, those things got worse. And then new things happening during the pandemic that weren't expected in terms of how people reacted to the isolation and whatnot, including people who were in nursing homes, because we know that if you didn't have dementia before, isolation is one of the risk factors for increasing your risks of dementia. So anything that was, brewing before got worse, some new things happened, and now we're still probably going to be dealing with the after effects for quite a while.
Mm-hmm. And sometimes the silver lining to something like a pandemic is that it shows us maybe where there are weaknesses in our system.
Absolutely.
What did it teach us about maybe not just our weaknesses, but also some of the places where we have strength in our healthcare system?
Yeah, so as you said, I come from a unique perspective because prior to being in public health, which I was in public health for 10 years, I was a family physician, worked as a hospitalist, worked in mental health and addictions, worked in the military as well. So I really saw quite a variety of different types of medicine and challenges. Certainly during the pandemic, knowing that the healthcare system was what we need to protect, I think New Brunswickers stood up and heeded the call to really do their part. I really want to thank New Brunswickers for doing their part during the pandemic because they absolutely did. And they really did recognize the severity of the situation with respect to our healthcare system and the health service needs that could and couldn't be provided at that time. So now, looking back, hindsight is 2020, obviously, but some things we knew going into it, as we already knew, we had an aging population. We do have some chronic health conditions here that are more prominent in the Maritimes and the East Coast than elsewhere in the country. So those two things combined, I think, also motivate my desire, my passion to work upstream. So what can we do to prevent these chronic diseases? What can we do to prevent these things before they become a problem? And again, where are people succeeding elsewhere in the world? So I also like to look at research out of Harvard and the things like the blue zones. I'm sure you've seen the documentary, and evidence-based research that shows how a community or a city or an institute or a business or a restaurant can become designated as a blue zone. I'm really interested in those kinds of things because they really align with those prevention pieces. And so if there's a grassroots movement to kind of go in that direction, then there's quite a bit of information online for people to do that. At the same time, in parallel, looking at the big picture policy items and legislative and programming pieces that could be implemented or researched in terms of things that could happen. So right now, I think starting from scratch or starting at a baseline, looking at data in terms of where are we, what are our population health outcomes that we're looking at, and we're talking about mortality, morbidity, life expectancy, rates of different chronic diseases, and how could we improve those over time and track them. So I love the idea of during the pandemic we used the phrase flattening the curve, and everybody understood that everybody had a role to play in flattening the curve. So let's say we know that we have projections for healthcare service needs between now and 2050, and it's not pretty. The healthcare service needs are going to keep increasing. How can we flatten that curve of healthcare service needs between now and 2050? What are all the pieces of information and work that can be done to help that between now and then? So that's really one of the big things that I'm looking at.
And I understand you're going to a Healthy Cities conference in Copenhagen, and so I imagine that would show you around the world different strategies and initiatives that other countries and cities are taking.
Absolutely. So that's work with Trevor Hansen. He's a professor of engineering at UNB, and he's leading this research project. So it's a Healthy Cities workshop called 8 to 80. So showing how this city in Denmark, in Copenhagen, is really a livable city for people of ages 8 to 80 to keep them healthy, to promote healthy activities and connections, and really is really inspiring in terms of being able to go there, see what they're doing, learn about what can be done here in New Brunswick, and having those conversations stimulated to make some gains in those areas.
You mentioned that there are some issues, health issues and healthcare issues in New Brunswick that are more prevalent than the rest of the country. Can you talk a little bit about what we're seeing on the East Coast that might be more of a pressing issue than they see in the rest of Canada?
Well, I think the data prior to the pandemic, and I haven't looked at it, I'm sure we've had some changes during the pandemic, but even prior to the pandemic, we had, as I said, aging population, which comes with certain chronic diseases, and then certain chronic diseases like diabetes and cardiac disease and cancers. So I think if you look at the rates across the country, I'm pretty sure that New Brunswick has higher rates in some of these areas among certain age groups. So what can we be doing to decrease those things? What kind of policies and legislation are put into place elsewhere that decrease those rates of chronic diseases and cancers and things like that?
The Institute does a lot of research. What are some areas of research that you'll be looking into going into 2025?
So, because we just started in December and I only just recently hired my scientific director, we were only just getting those pieces off the ground, because the first phase of getting an institute up and running is to have all the documentation and proposals put forward to the Board of Governors and to the Senate of the university. So that pretty much took our time up until May. And then, so once we got the Board of Governors approval and the University Senate approval for the Institute, then we could start doing the other pieces of work. So we're now in the preliminary stages of applying for funding for different types of research, and we haven't officially received the funding, so I don't want to go too far into it, but just to know that some of it involves work with some folks down in St. John around inner city schools. Mm-hmm. Some have to do with Indigenous populations. Some have to do with just the projects in terms of modeling what we're trying to do in terms of the policy and legislation pieces and programming, and then also work with Dr. Pam Jarrett in terms of she did some work on the Health Seniors Pilot Project over the last 5 years. So following up on some more work that can be done that came out of that research.
We talk a lot now about social determinants of health, and I'm wondering if you can explain for people at home who might not know this terminology what it is and how it factors into a person's health and well-being.
That is a great question, Vicki, because I think it's not talked about enough. Because when we think of someone's health, most people think about health care and they think of a physician or a nurse practitioner and nurses and hospitals. And that is one part of population health and what contributes to our health. And if you go on the New Brunswick Health Council website, they kind of break down that information in terms of what actually contributes to your overall health. And there's other websites that you can look at as well for that information. And if we think about, there's this thing called the Friedman's pyramid of prevention. And so if you look at the top of the pyramid in terms of prevention, healthcare service needs and contributing to your overall health, the physician is at the top of that. The healthcare service, the hospitals, the nurses, that's all at the top. And at the bottom, down here, are the social determinants of health. And everything in between is important. We're not saying they're not important. They all contribute to your overall health and well-being in a different way, a different proportion. So when I talked about screening earlier, so that's like halfway down here, colon cancer screening and breast cancer screening. And then again, down at the very bottom of that pyramid is the social determinants of health and policy and legislation. So things like housing, things like safety and security, do you live in a safe place? Things like education, things like race and gender, things like the environment that you live in, whether it's do you live in a walkability, an area that's walkable? What is your built environment like? Do you have access to clean drinking water? So there's all these things. The social determinants of health really are the basics that people need to be healthy and contribute so much to our health that we take it for granted in some ways. But yes, those are the big ticket. There's 12 social determinants. So I didn't list them all, but there's 12 of them, and they really do impact our health in a really large way.
So the Institute of Population Health will be looking at not just the healthcare system itself, but the whole environment that New Brunswickers are living in and where improvements could be made? Absolutely.
In fact, I was talking to the mayor here, Brad Henderson, a few months ago, well, even a couple of years ago, actually, because I was here in 2021 for a different purpose. But at that time here in St. Andrews, there was a very huge need for housing. And the last conversation I had with the mayor, he talked about how the Regional Service Commission had worked out some plans around how to address that, and it sounds like they've been very successful. So housing needs across the province are an issue, I think, across the country. Mental health and addictions are huge needs around the province. So I think if you have a safe place to live and a stable place to live, that's one big key piece of our overall health and well-being. As I mentioned, education, and so for the Institute, anything that has to do with these areas that are specific to New Brunswickers, I think there's some commonalities among the different populations around the province, whether they're Indigenous or whether they're non-Indigenous, whether they're newcomers, etc. So there's all different pockets of populations that have unique issues, and then there's some that are common to everyone.
And then, as an example, you're here in St. Andrews today for a conference. Can you tell us a little bit about what the conference you're here for is about?
Yeah, so it's a First Nations Health Summit, and really I was just participating in the first day. It's a 3-day conference, and really the leaders of the health services in the Indigenous populations and communities around the province were in attendance, as well as the chiefs, and it was really the launch of their logo, and as well as the ceremony to instill Roxanne Sapir as the Executive Director of the Organization on Health Transformation for First Nations.
What do you hope, where do you hope the Institute of Population Health will be in the future, maybe 5 years down the road? What are the goals you have in mind?
So I think some days I wake up and I think this is my dream job and this is exciting and it's all wonderful, and then other days I think, wow, I really want to make sure this is an institute that is sustainable over the longer term and meaningful and is able to contribute overall in the longer term to population health outcomes. So I think, I have kind of a 1-year, 3-year, 5-year goal and beyond, but it really involves having a mechanism where we measure those population health outcomes. We're looking at the things that can impact them. We're implementing those things that impact them, and then we're measuring again. Did we impact them? So kind of having something that feeds into this flywheel kind of system that is an ongoing, sustainable way of approaching the health of the population over the longer term. So in perpetuity, really.
How did your role in public health as the Chief Medical Officer of New Brunswick prepare you for where you're at now? You were navigating a strange time and no one knew what was to come, and I imagine if you're starting a new institute, it must have some similarities.
Yes, you're right, actually, because, and again, I asked this to the president when he asked me to take on this role. I said, well, I've never done this before. But I think when you're in a leadership position, you understand how to surround yourself with people who do know how to do the things that you don't, making sure you have good support that way and a good team of people around you. So I think in that way, yes, during the pandemic, there were certain people within our team at the Department of Health and in government. It was an all-of-government approach, really. So everybody had their role and everybody had what they needed to succeed. And I think the other thing about leadership is you always try to empower the people that you're working with to be able to make decisions and have what they need to succeed and help the organization succeed. So I definitely had, I guess, experience in that regard, yeah.
And I imagine, too, you're so well-versed in collaboration between different levels of government as well as different nonprofits and organizations that are all trying to work together to deal with health issues. So you come with that experience, too. That must be helpful.
Yes, absolutely, because relationships are key in terms of the network of people that you are going to be able to work with and have as stakeholders, as partners. So throughout my career as a clinician, throughout my career in public health, definitely made a lot of connections that just keep coming back. Like let's say I worked with somebody in government on a certain file, that then they move to a different part of government and they're in a different role, and so but that experience and shared time on different files then helped with that relationship in their other roles. And I feel like I have a bit of a 20,000-foot view of all of these areas because I was a clinician, I was in public health, I worked in government, I worked in the military, I worked in mental health and addiction. So I definitely see the big picture of how these things can fit together. And our strategic plan for the Institute does include a little visual that kind of has the Institute in the middle, and then kind of academia and the research side, and then and the data side. And then the other partners, whether it's government, whether it's the regional health authorities, and other partners like Public Health AG of Canada and et cetera. So I agree with you that there's definitely advantages to having the experience and those connections and those relationships to be able to feed into what we hope to be a very successful institute. It's
very rare here at CHCO that someone comes to sit down on the couch that everybody knows who you are. From the 17-year-olds and 18-year-olds that work here to our oldest volunteers, everyone knows Dr. Russell. How did that change your life? I don't think you could go anywhere without someone stopping you nowadays.
It is true. It is very true. I am recognized widely. Pros and cons. And they're mostly pros, because I think the only cons is just, knowing that when I leave the house, someone could recognize me. So I have to make sure what I'm wearing is, I look a little bit put together. I'm not just going to go out with my hair up well, actually, that's not true. When I go to the gym, I come home and that's what I look like. But yeah, so it's lovely. I have to say that I did not expect that. Early days, I think the first time it happened, I think I was in Staples buying something, and people approached me, and I remember being approached even with my mask on. At some point, somebody approached me. It's like, oh my goodness, you can recognize me with my mask on. But at some point, we only saw people with masks on. It's lovely in the sense that, you know, most New Brunswickers made a lot of sacrifices. It was a really hard time for everybody, and some people are still recovering from it. Including myself. I mean, I had to get this kind of support that, you know, everybody gets support, whether it's from a psychologist or a counselor or their family doctor or friends or family. So I have felt very supported in getting through the pandemic. And so when people come up to me and thank me for the work I did during the pandemic, I'm grateful. But it was a team effort. It definitely was a team effort, and I definitely appreciate the team that I worked with during that time. And I know that I was the face of, you know, that advice and reassurance and information. And I took that role very seriously, even among the team that I worked with, because I remember coming into work one day and thinking, okay, I'm all dressed up because I'm going to go in front of the camera and I've got my makeup and my hair. And one of the staff people said, oh, we always like to see you looking your best because it makes us feel good and have confidence in what we're doing and inspires us as well. So it's like, wow, I was thinking of the people on the camera, but I wasn't thinking about my team needing to have that reassurance and support as well.
You were such a reassuring face through that. I think none of us knew what we were feeling at the time. It was such a, I hope, once in a lifetime experience. And I wonder too, how does that prepare us for thinking about maybe another pandemic or some kind of health disaster that could affect the whole world? Does it feel like we've got some tools from that now that we can apply to going forward?
I think so, and I think you're right in that. I think certainly in the public health world, there's always the idea of planning for the next crisis, whether it's a climate crisis like we're seeing with, you know, climate change and forest fires and whatnot and displacement, or whether it's another pandemic, whether it's, you know, the next virus of you know, emerging. Lessons learned, you know, I think that self-care, looking after each other, but looking after our own mental and physical well-being so that we can support our families and our friends and our communities and our colleagues. I think that resilience has to be something that's invested in. So it's not just something that just happens. You know, are some people more naturally inclined to know where to reach out for the tools and the skills and the help and the support? Probably. But that's not to say that people can't learn those skills as well, in terms of how to make sure that they have the right support and their families and friends and communities and colleagues have the right support. So yeah, that preparation in terms of that mindset of, yeah, we could need to be doing these things, I think. And I think if you look at the communities that have really struggled in the last couple of years with forest fires and whatnot, they have lessons learned as well. You know, they've already lived that. They've already been through the displacement aspect, and whether they can move back to a place that's being rebuilt or not rebuilt. And I mean, I think Fort McMurray was kind of the first indicator of that. And I'm pretty sure the mental health needs out of that evacuation probably took at least 2 years or more to recover from, and was definitely something that, again, it's an investment in terms of what we need to do for the future. And I think even, you know, from an insurance perspective, I think there's companies that are looking at, you know, what do we need to do to protect ourselves in the future, and with respect to our homes and whatnot. So I think there are lots of lessons learned, and I think that yeah, I think looking after our own mental health and our own physical health, and being able to support others, and also advocating for others. So I wear another hat as well. I'm the president of the New Brunswick Canadian College of Family Physicians, and that's just a new role that I took on in the last little while. And it's really an advocacy role for family physicians in the province. We're very closely aligned with the New Brunswick Medical Society in terms of things that we're trying to work on together to help the working conditions for family physicians, because it's hard to recruit and retain family doctors if you don't have those conditions lined up in place to make it a place where people want to work.
And on that front, how is New Brunswick doing in terms of recruitment, both doctors and nurses?
I don't have data on that right now. Before I left the government, I think they were always making good strides. I know the people that were working on those issues, and I know they had at one point had gone to the Philippines and recruited a couple of hundred nurses from the Philippines. So I don't know the status now. I think there's still challenges and will continue to be challenges. So I think it's going to be a continuous effort. I think it's not just we're zip and we're done. I think we're going to have to keep working at recruitment and retention for healthcare workers.
And finally, Dr. Russell, you've had a fascinating career with many chapters. What was it about the executive director of the Institute of Population Health that made you say yes? Why was that a job you said, this is the next chapter for me?
So before I went into public health 10 years ago, I was working as a clinician, as a family physician, and I was working as a hospitalist, and working as a family physician in addictions and mental health and, in the hospital system, I just really didn't see enough evidence of prevention and preventative kind of policies and any kind of things that could really prevent people from having chronic diseases in the first place. And so I think that was what really motivated me to go into public health. And then being in public health for 10 years, realizing that, there's a lot of emerging issues in public health, and you're sort of putting out fires. And so that upstream work is done slowly in the background, but now I get to focus on it exclusively. So for me, it was a no-brainer decision to go into this area and this field, because it's been a passion of mine for so long.
Well, thank you so much for coming in today, and I don't think it can be said enough. Thank you for everything you've done for New Brunswick and continue to do.
Thank you so much, Vicki.
My guest today has been Dr. Jennifer Russell, Executive Director of the Institute of Population Health at the University of New Brunswick. I'm Vicki Hogarth. Thank you for watching Southwest Magazine.
Southwest Magazine is a news and public affairs production of CHCO Television.